You don't need a hospital or lab to understand your body better, because your health speaks to you every day in small and simple ways. From the beat of your heart to the way you balance on one foot, your body gives clues, and you can read them right from home. In this video, we're uncovering 10 powerful health checks that you can do yourself without any special tools or medical training. These tests are simple, science-backed, and give real insight into how well your body, brain, heart, and more are performing. Stay till the end, because every tip might reveal something you never noticed before, and your body will thank you for it. Check your heart rate naturally. Your heart rate is one of the simplest indicators of your overall health, and the best part is, you can measure it at home without any equipment. All you need are your fingers and a quiet environment. Sit down calmly, relax for a few minutes, and then place your index and middle fingers on the inside of your wrist, just below the base of the thumb, or on the side of your neck, beside your windpipe. Press gently until you feel your pulse. Then count the number of beats in 60 seconds. That's your resting heart rate. For most adults, a healthy resting heart rate is between 60 and 100 beats per minute. Athletes or physically active individuals may have a rate lower than 60, which is perfectly normal. If your heart rate is consistently above 100 or below 60 and you're not an athlete, it could indicate stress, dehydration, anemia, hormonal imbalance, or even heart conditions. It's also a good idea to check your pulse first thing in the morning before getting out of bed to get the most accurate resting reading. This small habit can give you early signals if something's off in your system. Heart rate can also reflect your mental state. Stress, anxiety, and poor sleep can cause noticeable spikes. By checking it regularly, you'll be more in tune with your body's response to daily life and know when it's time to make changes or consult a professional. 2. Test your breathing rhythm. Breathing is something we do without thinking, but it's also a powerful indicator of our internal health. By simply observing your breath, you can detect signs of anxiety, poor lung function, or even cardiovascular issues. To start, sit in a comfortable position with your back straight and shoulders relaxed. Set a timer for 1 minute and count how many full breaths you take. 1 inhale and 1 exhale equals 1 breath. The normal breathing rate for a healthy adult at rest is between 12 and 20 breaths per minute. If you're consistently breathing more than 20 times per minute while sitting still, it could mean your body is under stress. Rapid breathing, known as tachypnea, may be a response to anxiety, fever, or respiratory problems like asthma or infection. On the other hand, very slow breathing might point to fatigue, poor lung capacity, or even issues with oxygen flow. Try breathing through your nose rather than your mouth, as this helps filter and humidify the air. Observe if your breathing is shallow, quick, or deep and controlled. Shallow breathing can leave you feeling tired, foggy, and anxious without you even realizing the cause. Deep, slow breaths activate your parasympathetic nervous system, which promotes relaxation and calmness. Practicing breath awareness for just a few minutes daily can improve your focus, help with emotional regulation, and even reduce high blood pressure over time. Monitoring your breath is like listening to your body's silent signals, and tuning in can lead to better physical and mental balance. 3. Pinch test for hydration. Hydration plays a key role in your energy levels, skin health, and even brain function. One simple way to check your hydration at home is with the pinch test, also called the skin turgor test. Start by gently pinching the skin on the back of your hand using your thumb and index finger. Hold it for about 1 second. Then let go and observe how quickly it returns to its normal position. If your skin snaps back immediately, your hydration levels are likely in a healthy range. If it stays elevated or returns slowly, it may be a sign that your body is dehydrated. Dehydration can lead to headaches, fatigue, dizziness, dry skin, and poor digestion. In more severe cases, it can affect your kidney function and blood pressure. This test is especially helpful in hot climates, after physical activity, or if you've had a long day without drinking much water. Keep in mind, skin elasticity naturally decreases with age, so older adults may see a slower return even if hydrated. You can also check other signs of hydration like the color of your urine. Light yellow is a good sign, while dark yellow or amber may signal that you need to drink more fluids. Make it a habit to sip water regularly instead of waiting to feel thirsty, because thirst often kicks in after you're already mildly dehydrated. Using the pinch test regularly keeps you aware of your hydration needs, and it's a simple way to keep your body and mind functioning at their best. 4. Nail refill test for circulation. Good blood circulation is essential for delivering oxygen and nutrients throughout your body, and one quick way to test it at home is through the nail refill or capillary refill test. Start by holding one hand at heart level and press down on the tip of your fingernail until it turns pale. Then release the pressure and watch how fast the pink color returns. Normally, the color should come back within 2 seconds, which means blood is flowing smoothly through your capillaries. If it takes longer than 3 seconds, it could be a sign of poor circulation, low blood pressure, or dehydration. This might be caused by conditions like anemia, heart problems, or cold temperatures restricting blood flow. You can try this test on multiple fingers and even your toes to compare results. Always make sure your hands are warm when doing it, as cold skin can affect the accuracy. In children, this test is often used by doctors to quickly check shock or oxygen levels, and it's just as effective for adults monitoring their health at home. Other signs of poor circulation include cold fingers, numbness, or a bluish tint in your nails or lips. If you notice these symptoms regularly, it's a good idea to seek medical advice. The nail refill test might seem simple, but it provides a fast and valuable snapshot of your cardiovascular health. By staying alert to your body's signals, you can catch potential issues early and take action before they become serious. 5. Monitor signs of kidney health at home. Your kidneys quietly filter your blood every second, removing waste, balancing fluids, and controlling blood pressure. But early kidney issues often show no symptoms, which is why home monitoring is so important for prevention. Start by paying attention to your urine color and frequency. Healthy urine is light yellow and clear, not too dark or cloudy. If your urine is consistently dark, foamy, or has a strong odor, it could be a sign of dehydration or kidney strain. Also note if you're urinating too frequently at night, or if you feel pressure, pain, or a burning sensation. Swelling in your feet, ankles, or around your eyes can be a warning too, as it suggests your kidneys may not be removing excess fluid properly. Feeling tired all the time, losing appetite, or experiencing muscle cramps can all be connected to imbalanced electrolytes due to kidney dysfunction. Another check you can do is blood pressure monitoring at home. Since high blood pressure is both a cause and effect of kidney disease, use a digital BP machine regularly, especially if you have diabetes or are over 40, and aim to keep it below 120/80 unless advised otherwise by your doctor. Drink enough water, reduce salty foods, and avoid painkillers unless necessary, as overuse of some medications can harm your kidneys over time. By staying aware of these signs and making kidney-friendly choices, you can protect these silent workers before problems ever arise. 6. Do a simple eye health test. Your eyes can tell a lot about your overall well-being, and regular checks can help detect issues early. At home, you can do a few basic tests to monitor your vision clarity, focus, and eye strain. Start by covering one eye and looking at a distant object, like a clock or calendar on the wall. Check if it appears blurry, distorted, or if colors seem faded compared to the uncovered eye. Repeat with the other eye, and then use both eyes together to compare sharpness and focus. This can help you notice changes that may indicate problems like astigmatism, nearsightedness, or cataracts. You can also print or use an online version of a Snellen chart, which has rows of letters in decreasing sizes, to test your distance vision. Stand about 10 feet away and read each row one by one with each eye. If you struggle to read the middle rows or below, you may need an eye exam soon. Another good test is the Amsler grid, a square grid with a dot in the center. If the lines appear wavy, missing, or the dot disappears, it could be a sign of macular degeneration. Additionally, test your eye coordination by slowly moving a finger side to side and watching it with just your eyes, not your head. If you feel tension, skipping, or double vision, it could point to eye muscle fatigue or imbalance. Frequent eye strain from screens can also cause headaches, dryness, and blurred vision. Taking screen breaks every 20 minutes and blinking often can protect your eyes, and doing these checks monthly helps keep your vision sharp and healthy. Brain and nerve health. Your ability to balance is more than just coordination. It's deeply connected to your brain, nerves, muscles, and even inner ear health. To do a simple home balance test, stand straight with your feet together and close your eyes. Try to stay still for 30 seconds without swaying, moving, or opening your eyes. If you struggle to stay still or feel like you might tip over, this could point to issues with your nervous system, inner ear, or muscle strength. Next, try standing on one leg with your eyes open, and time how long you can hold the position without support. If you're under 40, you should be able to balance for at least 30 seconds. For people over 60, even 10 seconds is considered a good sign of balance and strength. This test isn't just for athletes or dancers. It helps detect early signs of conditions like Parkinson's disease, inner ear disorders, or even vitamin B12 deficiency. If you find it difficult, try practicing balance exercises regularly, like walking heel to toe, standing on one leg, or doing yoga poses like the tree pose. Improving your balance not only protects you from falls, but also sharpens your brain's ability to process spatial awareness. Always do this test near a wall or chair for safety, especially if you're older or have any history of dizziness or falls. Tracking your progress each week gives you a clear view of how your balance improves and helps keep your nervous system and muscles tuned up for daily life.